Oral minoxidil is the deadliest hair loss treatment currently on the market. And you know what's even scarier? It's becoming very popular. A lot of people are trying it to boost the level of their hair growth on the recommendation of people with zero medical qualifications or knowledge. So if you are thinking of using oral minoxidil, or if you're already using oral minoxidil and you want to stay alive, watch this video. Welcome to the video. My name is Jabril. I'm a hair loss consultant and a pharmacist for the last 14 years. So I'm more qualified than most people on YouTube to talk about this. And everything I share is going to be based only on 100% published science.
Minoxidil was actually developed in the 1970s for high blood pressure. It didn't prove very good for blood pressure, but scientists noticed patients who took it had unusually fast hair growth. So in 1986, a lotion version of minoxidil was developed specifically for hair loss. Although no clinical trials have been conducted on the efficacy of the oral administration of minoxidil for patterned hair loss treatment, an epidemiological study in Spain showed oral minoxidil, among the most used treatments for this condition, being prescribed in male patterned hair loss by 50.6% of dermatologists, and in premenopausal and postmenopausal female pattern hair loss by 67.9% and 63% of dermatologists. Minoxidil works by shortening the telogen phase and prolonging the anagen phase with a progressive growth in hair diameter and length. It basically prolongs the growth phase of hair and increases both the diameter and length of hair. Minoxidil has to be converted to minoxidil sulfate, which is the active form, before it can start to work in the body. Recent evidence suggests oral minoxidil can achieve higher concentrations of minoxidil sulfate in the scalp. In recent years, oral minoxidil at low doses has been proposed as a safe, effective, and well-tolerated option for patients with patterned hair loss with a good safety profile.
Now, let's stop here for a second. The clever ones, the ones that have been paying attention, will notice that they developed a cream version of minoxidil. You might be asking, why did they develop a cream and not just give the tablet for hair loss, the tablet that has already been around since the 1970s? Well, one of the reasons is even in the 1970s, 40, 50 years ago, they knew that oral minoxidil is just far too risky.
Minoxidil is a vasodilator. It relaxes and opens up blood vessels. The most problematic side effect is fluid buildup in the body. Critical organs such as the lungs and the heart can get fluid buildup, leading to very serious conditions like pericardial effusion and pulmonary edema. To this day, in most countries, including the UK, oral minoxidil is only licensed for blood pressure. And in the UK, it has to be given with other drugs to avoid the fluid buildup problems we just mentioned.
Now, using oral minoxidil does have some advantages over using the cream or lotion version. And here are some of them.
Common barriers for the use of topical minoxidil include the development of itching, contact dermatitis, change in hair texture, and the growth of unwanted hair. Aside from tolerability, there are several practical advantages of oral minoxidil over its topical formulation. It's more convenient to swallow minoxidil than to apply it topically. With oral minoxidil, people perceive better aesthetics, because oral therapy doesn't distort gray hair color or generate product residue. Oral minoxidil is cheaper than the topical over-the-counter formulations. Application of keratin fibers to visually enhance scalp fullness is simpler without the use of topical minoxidil. Oral minoxidil monotherapy may show an initial clinical response after approximately 3 months of treatment, which is usually quicker than the topical version.
By the way, I do offer some hair loss services, so if you are interested in having a one-to-one with me and you want to discuss certain things about your hair loss regime or maybe hair transplants or other stuff like that, all my services, the link will be in the description below. But bear in mind, these are not free services. This is my free content. I do this for free on YouTube, but the private service is not free. The next question is, according to science, who actually benefits most from using oral minoxidil? And the science is very, very clear in all the studies I've seen. The people who benefit the most are people with mild or moderate hair loss, not advanced hair loss. So let's talk about dosages of oral minoxidil. So there's two different dosages. So remember, we said minoxidil was initially invented for treating blood pressure. For that purpose, dosage is 10 to 40 milligrams, so it's quite high. But for hair loss, there's actually no established official dose. It's not a licensed drug for hair loss. It's used as something called off-label by experts, dermatologists, hair loss consultants. But from experience, we know that lower doses of 0.25 milligrams to 5 milligrams work quite well for hair loss. So now let's talk about more specifically about men. So all this is things we've observed from trial and error, from trying this out under expert supervision, or from studies. The effective dose seems to be somewhere between 0.25 milligrams to 5 milligrams. 5 milligrams per day is the most effective, but that comes with risks, as we'll see in a minute. In mild to moderate cases of hair loss, the higher doses bring higher risk of side effects. And by the way, 0.25% works very well for female hair loss. And interestingly, when men try 0.25 milligrams per day, that stabilizes their hair loss in 40 to 60% of cases. So even that tiny dose that works well for females stabilizes 40 to 60% of the men who take the same dose. Very interesting. Now let's talk about side effects. So this is something a lot of people are concerned about, and notice I use the word potential side effects. Side effects do not happen to everybody. Some people take all sorts of stuff and never have any side effects at all, and some people have everything. At the extreme end, the drug, as we said, opens up blood vessels, so it can cause fluid retention, so kind of swelling of the limbs and legs. And the serious part of the fluid retention is when fluid builds up around vital organs. So something called acute pulmonary edema can develop, which is basically the lungs filling up with fluid. Pulmonary hypertension, again to do with the lungs, changes to your ECG, which is the rhythm of the heart, the electrical rhythm of the heart, which obviously can be very serious. Something called pleural effusion, and the list of serious side effects actually continues. Some sort of a reflex tachycardia, which is the heart rate becoming quite fast. And some of the less common but also serious side effects can include pericardial effusion, which is again a serious problem with the heart, and at the extreme end, heart failure, congestive heart failure, especially with patients who already have some sort of a kidney disease. There's others, less serious but also fairly common symptoms. Something called postural hypertension, which is a drop-in of the blood pressure, especially when you stand up. Dizziness, so this is again linked to the hypertension. Swelling of the lower limbs, lower limb edema, some headaches, and some mild blood pressure changes. So according to the studies, 2% of people had to stop using oral minoxidil because the experts just couldn't manage their side effects. When someone has side effects, we try to manage it by maybe lowering the dose. For 2% of people, all these measures don't work and they have to get off, stop oral minoxidil completely. There is one side effect that is quite interesting, something called hypertrichosis. Now, in some studies, up to 24% of people experience this when taking oral minoxidil. Hypertrichosis is basically the growth of hair in unwanted places. For example, on your face, on your cheeks, chin, moustache. Obviously, this is more distressing for women users, but obviously some men don't really want weird hair growth in random parts of the body. So let's have a look at some studies, actual scientific studies that compare 1 milligrams of oral minoxidil versus the 5% topical minoxidil, basically Rogaine that you can buy in pharmacies. And so we want to know is taking the oral version of minoxidil actually that much better than the topical that we are willing to risk it? So let's have a look. So this was a 24-week long study, so quite a long study. They assessed the hair density using this technology, which is very advanced technology where you actually count how many hairs you have before and after. It's called Tricolab hair-to-hair matching technology. Looked at, does the participant have more hair with the 1 milligrams oral minoxidil or with the 5% lotion? In the oral minoxidil group, they noticed a 12% increase in hair density. So people that were taking oral minoxidil had 12% more hair than before the experiment. In the people using the topical version, which is the 5% minoxidil, they only noticed 7.2%. And they did the statistical analysis and they said this is non-significant change. And if you could just look at it from 12% to 7.2%, I mean, that's not significant. That's like less than 5% more hair in the oral minoxidil than in the topical. So nothing significant. Now, you can see, by the way, this is an actual screenshot of the results. So this is very complex. Let's talk about side effects. So in this experiment, 4% of the oral minoxidil group, people who took oral minoxidil, had edema, which is swelling. Swelling, for example, of the limbs, of the feet, of the calves, legs, those kind of things. And on average, there was an increase of 6.5% in the heart rate of the people taking the oral minoxidil. But the oral minoxidil, remember, quite often when people use the Rogaine or minoxidil lotion, one of the big problems is hair shedding, especially in the first few weeks. So with the oral minoxidil, it did a lot better. There was hardly any shedding, any hair shedding. So that's a good point in favor of oral minoxidil. And it was also good for people who had telogen effluvium, which is kind of a scalp condition that also causes hair loss. So it had its benefits. But overall, do we really think that 5% extra hair density is really worth all these issues? I personally don't think so, but you might differ. So let's go and look at another study. This study looked at a very low dose of oral minoxidil, 0.25 milligrams, tiny dose. And with this study, we just want to know, basically, is taking that lower dose, does it actually do anything? If you take a very small dose of oral minoxidil. And we had 25 participants, 40% of those had moderate hair loss and 60% had severe hair loss, and they all took 0.25 milligrams of minoxidil per day. They were followed up for 24 weeks, and people using other hair loss medications were excluded, obviously, because that spoils the results. And obviously they did the same hair density analysis that I talked about in the previous study. So the outcome was the people with mild and moderate hair loss achieved better results. So the 40% that had mild to moderate hair loss had much better results, which again shows that, if you delay in doing something about your hair loss, waiting for a transplant and all that, you really are shooting yourself in the foot. People always do better when they start early with the treatment. Now let's talk about side effects. So 4% of those people taking this very low dose had pedal edema, which is basically swelling of the feet. 16% had some hair shedding, which is a little bit higher than expected. And 20%, which is quite a lot, had body hypertrichosis. So this is the growth of excess body hair. The growth of excess hair, which can be on the scalp or anywhere else on the body. It can be on your chin, it can be on your chest, it can be in your arms, tummy, anywhere. Okay. And interestingly, 13 patients, which is half the group, had increased beard growth. Okay, very interesting. And there was no difference in the blood pressure, arterial pressure, and no reports of fainting or dizziness, and no patient had to discontinue treatment. And in terms of results, I think this is a screenshot from one of the participants. It's quite hard to see, I know, but it looks like a man, and that's actually a very good result. I mean, you can see the hair looks quite thin here, and after the 24 weeks it looks pretty good. So pretty good outcome. Let's do one more study. So this one is a little bit bigger. 41 men taking either 2.5 milligrams of oral minoxidil or 5 milligrams. So basically we want to see, do we get much better results? Are the side effects going to be different? This is what we want to see. So they noticed clinical improvement in 90% of patients. So in both groups, they had 90% of patients had significantly more hair growth, and marked improvement of at least 1 grade on the Norwood-Hamilton scale seen in 26%. So about 1 in 4 had basically improved. If they were Norwood, say 3, they became a Norwood 2. If they were a Norwood 4, they became a Norwood 3. If you don't know what the Norwood-Hamilton scale is, it's basically a scale where we basically assess the person's degree of hair loss. 9.8% of patients remain stable. So you can actually say that nobody lost more, because 90% actually had improvement and 9.8% remained stable. So that's pretty much 100%. So nobody in the experiment lost any more hair. Now let's talk about side effects. Hypertrichosis, which is growth of excess hair, lower limb edema, which is swelling of the lower limbs, and shedding were noted in 24.3%, 4.8% and 2.4%. So it seems that the higher you go with the dose, the more common side effects become, because remember in the previous study when people were taking 0.25%, the numbers were a lot lower. We were kind of single digits, low single digits. But for example with hypertrichosis, 24%, that's very, very high. And there's it's worth mentioning another study of 30 male participants. They took 5 milligrams of oral minoxidil daily for 6 months, and 100% of patients showed clinical improvement, as in they grew more hair. Well, and 43% of them showed marked improvement, as in they showed, obvious improvement. So it seems that the 5 milligrams works very, very, very well for hair growth. But the rates of adverse effects, side effects, were higher. For example, 93% developed hypertrichosis, 10% developed edema, swelling, and 10% had changes in their ECG, which is the heart rhythm. So in conclusion, for me, having looked at the evidence, trying oral minoxidil is an absolute last result. And even then, if somebody wants to try oral minoxidil, they need to go and see an expert, get checked, and then after that they need to be monitored for the duration of the treatment. While they are on oral minoxidil, they need to be monitored. So that's my advice. If you want my personal advice to look at your hair loss regime and make it tailor-made for your needs, help you source reputable ingredients, then I do have a hair loss advice service. You'll find the details in the description below. Anyway, take care. See you later.